Hi, my name is Dr. Virginia Von Schaefer, and I'd like to take this opportunity to tell you a little bit about myself and my background so that you might understand me better when you meet me. I was never really interested in going to medical school. My undergraduate school interests lie in studying Latin and music and art. And I wasn't until I became ill and my first pregnancy was found to be a tumor that I became exposed to doctors and what they did and what the field involved. And I had an especially difficult situation because in those days ultrasounds were not available or not very accurate, and so I had to wait till I was 5 months pregnant to find out that I didn't have a baby and I had a tumor ball instead. So it came time for the delivery of the tumor, and I had to sit there with this typical Pitocin drip to try and induce labor, which didn't really work, and so they kind of hooked me up for the weekend, then sent me back to work and said, come back next weekend, we'll try again. And the very next day, I went into septic shock and had to be admitted to the hospital emergently. And my doctor was just a really wonderful man, and he came to take care of me even though it was going to be his vacation. He canceled and helped me through everything. And I was very fortunate because the tumor itself was a tumor of the placenta, was benign. So I did not have to have an emergency hysterectomy, and I did have to be surveyed for at least a year to get a kind of clean bill of health and determined that I wasn't going to develop a malignancy, and then I was allowed to get pregnant. And so I went on to have 5 wonderful children dispersed in the varying phases of my education and medical practice, and I feel very fortunate that I was able to have that experience. In those days, most women who were at my medical school in Columbia, if they did have children, were not allowed to have a full-time teaching position, and there were quite a few restrictions. In fact, I was the first woman that they admitted to Columbia Medical School with a child, because my firstborn, my son, was already just a year or two old. And then during the first and second year, I gave birth to my first daughter, and a few more came later. But I feel very honored to have had the opportunity to get this education and have the experience of motherhood, and also to have the experience of difficulty. I think having had to face cancer myself and experience the ambiguity and wonder if I was ever going to be all right, even though fortunately it didn't come to that, I did have to process that, and I feel it's always been of great help to me in understanding my patients and what they go through. When I did go back to school after I had this tumor and was able to get pregnant again, I kind of quit my job that was in a kind of retail area there in New York, and I went back to school and studied an undergraduate biochemistry and cell biology at Columbia, and then went on to medical school. So I had also another great opportunity because in those times electron microscopy was just being used much more frequently, and research was done to elucidate the microscopic nature of cells and organelles, functions of cells, and many amazing things came out of that time. And even though probably your grade school kids talk about mitochondria and all those things nowadays, in that time it was quite a remarkable event. And it led to a lot of wonderful discoveries and spurred me to think about medical problem solving using the techniques of cell biology and biochemistry that were obviously now available. However, in my medical school education, although it was a wonderful education, it was very oriented towards traditional use of drugs and surgery and radiation and all those other techniques. And there wasn't a lot of crossover between what people understood about the workings of cells and how that might be applied to medical problem solving. So that was always in the back of my mind. It was a dream I had to realize, but it took many, many years for me to come to that. I did study medicine and surgery and practiced as a trauma surgeon, and went on to be a vascular surgeon as well. Unfortunately, I had a spinal cord injury, and I had to stop practicing surgical practice, active practice, very abruptly. And in the process of my recovery from that, because my arms and legs were numb for about 2.5 years, then I turned back to my thoughts about using cell biology and biochemistry and for medical problem solving, because at that point I personally had a lot of problems. I was in a kind of early menopause state, and I had the opportunity to meet some people who were kind of pioneers in using bioidentical hormone therapy, and so I started working in that area, first to help myself and then to help others, and went on to have some very interesting experiences working in clinics and for people who didn't have any money and no one kind of cared about them, and I had the opportunity to kind of work with solving their problems using all these basic principles, and found I could get remarkable results and solve problems that nobody else could solve with really fairly simple tools and just thinking about the biochemistry of the problem, what wasn't working right, what you could do to make it work better, and it just turned into an amazing difference in my career. So even though I couldn't make surgeries on people anymore, and I did learn a lot about metabolism and endocrinology and trauma surgery, and I took many of those principles and applied them to just regular everyday patients. But my life changed after that injury, and I was thankful for it, even though I didn't ever really return to practicing surgery actively. At one point I was going to, I had another accident and injury, and again, more problems that I had to solve for myself. So it seems as though over these years I've always had challenges in my own life and my own body, and tried to solve them and meet those challenges in as natural a way as possible. I did do some research in cancer when I was in a surgical resident, and I studied the effect of direct chemotherapy infusion on liver of poor rats I gave cancer to, but it was a situation of trying to test that direct infusion of a drug called 5-fluorouracil. And interestingly, of course, it didn't work that well then. People are still trying to use it. It's a drug that is used extensively in this country and outlawed in other countries because of its profound negative side effects on the metabolism and neurotoxicity and GI problems. But it's just one of those things that we keep going to, it seems, in our practice of medicine, even though it's toxic and really doesn't work that well. And when my sister got lymphoma and leukemia, we had another interface with drugs in terms of the traditional treatments for leukemia and lymphoma involve immunotherapy. And although I was not my sister's treating physician, she had a traditional oncologist, I was her caregiver, and I took care of her for 4 years before she passed away. And I saw her not really change her diet or do anything. Of course, there's candy in the doctor's office, so they didn't really encourage that. And the drugs seemed to work, but then the tumors would come back, and And then eventually the use of experimental drugs was brought up, and she tried it, but she pretty much died in 3 weeks from a very serious complication of the medication. So when I finally got over grieving her death, really, I looked for work and I thought, this is a very interesting field. I want to be involved in people at this time where kind of life and death sort of reflected in how I worked in trauma surgery as well. But I wanted to see if I could do better for people than what I saw happen to my own family member. And so this is what drew me to this work. And I believe that it's really probably the greatest field to practice medicine right now, integrative oncology, because you can pull treatments and techniques from every discipline and every aspect of medicine. You can use herbs, you can use all kinds of things, you can use traditional drugs in traditional ways or different ways. There are many adjunctive treatments, and every day it seems someone is trying to think of a new way to block the growth of cancer cells, not just by cytotoxicity or killing with a lot of chemotherapy, but blocking the pathways or basically aspects that allow cancer cells to thrive and replicate in such a rapid way. So there's many different things that can be used. It's very exciting to interact with people who have this problem, because traditional treatment is kind of scary and it doesn't really sit well with many people. Many people can't tolerate it. And this way I can help people walk through this problem and see their way through it and move on to take advantage of the opportunity of illness to create a new focus for your life. It's kind of what happened to me, and I feel it's a privilege to be involved in people's lives in this way. So that's kind of me in a nutshell, and thank you for listening, and hope to meet you sometime soon. Thank you.